Well, a frightening scenario playing out in Oklahoma. Dental patients now getting tested for HIV and hepatitis, why their doctor may face criminal charges, and their legal options. The lawyers break it down for us next. New developments in a frightening health scare for anyone going to the dentist. 7,000 people waiting to get tested for HIV and hepatitis after an investigation uncovered filthy conditions at an oral surgeon's office. Bringing in our legal panel, former prosecutor Jeff Gold and defense attorney Rebecca Nitkin. Good to see both of you on this Easter Sunday. Happy Easter.
Thank
Happy
you.
Easter.
So let's talk about this, because we're talking about possibly more than losing a license. If you have these patients who have contracted lifelong medical illnesses with the medical expenses that go along with that, and God forbid someone dies as a result of this, what could he be facing? Jeff, we'll start with you on this one.
Well, he certainly can be facing felony charges. There's two requirements. Number one, of course, that he violated the standards by the dental board, and that he did so willfully. You know, whether this rises to it or not, we don't know. I mean, there's 7,000 people being notified, but there's only really one case so far. Is it worth a criminal investigation? Sure, it certainly is worth a criminal investigation.
And Rebecca, you say what?
I say definitely there can be criminal charges, but there's a lot more that I want to learn about. I mean, we're being told that there's medication that has been expired. Is it in the cabinets or has it been distributed? Are the seals broken? We're being told that the dental assistants administered the sedatives. Was the doctor present? Nobody has ever died, so they actually did a good job. Does this violate the rules there? We're being told that the needles were put back into the medication after they were given to the patient. Was he through with it? Or did another patient come in and have that same needle used? There's widespread panic, but there's not enough. I don't understand about the rusty tools as well. They said they were reserved. Does that mean that they were never used, or are they being used on patients? There were 7,000 patients.
But Jeff, Rebecca did mention there are hygienists who also help assist. You've got the staff who would clean. I mean, who else could possibly be in trouble here?
Look, they could lose their licenses too, but more importantly, he used assistants who weren't licensed. I took a look at the complaint. He used rusty tools. He used bleach to clean the tools. He used assistants that weren't licensed. He used assistants to do anesthesia. The medicine cabinets, which had the controlled dangerous substance, the drugs were unlocked and unsupervised. He reused needles. There's plenty to look at this doctor. It could be a nightmare. We just don't know until we see what the response is from some of those 7,000 other patients.
That is the point right there. It could be a nightmare. 7,000 patients have been in his office. There's no excuse for shoddy practices at all. But why has there been 7,000 patients in this doctor's office and there have not been complaints? Why have 7,000 patients been in this office and there haven't been people complaining?
Jeff, I'll give you the last 20 seconds. Go ahead, Jeff.
Susan Rogers, who's the spokesman for the Oklahoma Dental Board, said that that he was a provider for Medicaid, and that Medicaid patients have a higher percentage of infected patients because of their low poverty status.
They know how to complain. Look, Medicaid patients know how to complain.
Let me jump in here, guys. There are plenty of layers that have to be peeled back on this. Jeff Gold, Rebecca Nitkin, I've got to leave it there. Thanks for your time this morning, and we're back in a moment.